Hello and welcome to C-Suite Middle East. I'm your host, Shane Phillips, and today we look at the story of Zara Hospital, a brand which was phenomenally strong in Sharjah, but when they first entered the Dubai market, they struggled to find their stride. A new CEO was brought in, Dr. Mohaymen Abdelghany, and today he shares his insights on what he did to drive the organization to peak performance. Dr. Mohaymen, from a leadership perspective, how do you use success metrics and your management dashboard?
If you have a strategy and you need to execute it, you need to make sure that it's properly monitored. And if it's not monitored, you will not be able to assess whether it's successful or not. One of the things we did here is we developed the business and strategy unit, which works with all the executive team in order to develop a dashboard, and the dashboard monitors the different dimensions of strategy, be it patient experience, be it quality, be it clinical outcome, be it growth or margins. All these are monitored on a dashboard, and a clear accountability is given to each stakeholder within the team. This is really reflected in each executive committee meeting, where we review the performance and look at the dashboard and monitor the gaps. Where are the gaps, and who is to close these gaps, and what actions need to be done. So this is very important for us in order to make sure that the strategy is executed. We have an automated tool where we look at this and keep monitoring that. As we find any gaps, we start working as a team in order to address it. So part of the leadership is to make sure this is an ongoing, and working with this data is part of what the organization does. Working with information is to make an informed decision is part of the leadership role, to enforce along the executive team and along the entire clinical leadership.
So as the CEO, you set the vision, you set the strategy, then you actually create a team to create the bespoke metrics on the deep indicators to measure our success as we achieve this.
Exactly. And that is cascaded down to the different unit level. So it goes from the CEO office to the executive team to the units, and even the department heads. Everyone is aware about the metrics that they need to monitor. And that all sums up towards the overall strategy and goals.
What do you feel are some of the key deep indicators, outside of revenue, net profit, obviously quality care is important?
Actually, one of the most important aspects is we look at patient experience. So we look at two aspects as key drivers: clinical outcome and patient experience. When you have a good clinical outcome and you have a good patient experience, a byproduct is revenue and growth. So when it's like focusing upstream on clinical outcomes and on patient experience. We keep monitoring patient experience, for example, not only through surveys and assessing the word of mouth or different feedback mechanisms, but also we do mystery shopping. So we have mystery shoppers coming to the hospital, getting the pulse and feel of what's going on, and feeding back the executive committee where the gaps are. Even our eyes would not be able to see it without this mystery shopping mechanism. We do have questionnaires for all our providers, and they ask each and every, we have a sample of the patients who come. The call center calls back and gets the feedback of each and every provider. And this is fed back into their monthly scorecards. So they see how the patients are assessing and what their patients are telling about them. So it's very important for us to feel this pulse and make it on an institution level.
So you change the way you measure performance, you automatically change the performance.
Exactly. So that's reflected actually in the way, let's take a group, doctors perceive patient experience. Earlier they were perceiving it as part of the amenities, the nursing services, but now they started to understand their role in that, because they felt that their role is very crucial. The way they handle and communicate and explain to the patient plays a major role in building that experience that the patient has. It's not the amenities, it's not the nursing staff. It is to some extent, but doctors now realize their role in that. And if you work across different groups, making them understand their role in patient experience, how you assess it and how you present it to them, and how can you bridge these gaps. So one of the things we did, for example, was based on this, we decided that there are certain crucial conversations that needs to be taken in place, which is not taking place. So things like when you want to get the people from silence, get them speak up, or get them from violence, get them calm down. A crucial conversation happened between a doctor and a patient, between a doctor and a doctor. You need to train the people on that. So we started a training program for them, identifying what are the crucial conversations we should have in healthcare, between a doctor and a doctor, between a nurse and a doctor, between a doctor and a patient and others. And that really helped them advancing their patient experience understanding and moving to the next step.
Regularly, a CEO is a leader of leaders. A CEO of a hospital is a leader of physician leaders, which causes more challenge.
Well, it is a challenge. I was privileged to, being a physician myself, I was privileged to understand how to bridge that gap. I can feel their pains. I spend a long time of my life into being an anesthetist, into the operation rooms and the ICUs, so I can understand where their pains come from. This is one good thing. But the working with physicians is very, very important because they are the engines of any hospital or healthcare organizations. You need really to listen to them, to understand what their problems are, to help them providing the right resources, to align for them the incentives to work together. When I say incentive, I don't mean financial incentives, but the incentives to perform. The support they need in the teams, the support they need in the OR, the support they need everywhere in the hospital in order to perform. So it's a challenge to work with physicians, but once you get it right, it's really a blessing rather than a challenge.
Thank you so much, Dr. Mohaymen.
Thank you, Shane.